Hello, my name is Dr. Arandi. I'm assistant professor in psychiatry. Today I will present a short point about vitamin D. As we know, vitamin D is a vitamin. It is a sunshine vitamin. It is mainly supplied from the sun rays. There are two forms for vitamin D, vitamin D3 and vitamin D2. Vitamin D3, as you know, we get it from the sunlight, especially between the 10 a.m. to 3 p.m. because it is more directly affect the skin. The precursor of vitamin D is storage in the dermis of the skin. So it is by the ultraviolet rays from the skin, it is transferred to D3. D3, it is absorbed, go to the liver with D2. As you know, D2 and D3 should go to the liver where it is metabolized and turned to activated form, and then it is go to the bloodstream, and from the bloodstream it go to the intestine and to the kidneys. The role function of vitamin D is to regulate the absorption of the calcium and phosphorus from the intestine to the blood. After that, it is underlying the supervision of parathyroid gland, which is essentially for the controlling of vitamin D levels. From the point of view, from the levels of vitamin D, it is ranged from 30 nanogram per milliliter, which is a smart point. It can be, which is called insufficient if it is below 30. It is called deficiency if it is below 10 nanogram. And it is normal to be from 30 to 50 nanogram per liter. But if we have some reason, there is deficiency, which is could be obvious, it should be more about 50 nanogram in the blood. There are many indications for vitamin D. The indication for vitamin D actually in infection, it is in heart failure, in kidney failure, in cancer, in respiratory tract infection. It can be used also in psychiatric disorder. Also, it is used to improve the immunity of the immune system, low lymphatic system. In psychiatry, we use it in seasonal affective disorder. It can be used in depression, in anxiety, in schizophrenia, in dementia, in sleep disorder. If we look about the way it's act, it is about the half-life of vitamin D. The half-life, it is from 1.5 days to 3 days in the blood. Because it is fat-soluble vitamin, it is stored in the fats in the body, and the half-life it is from 2 to 3 months. So the efficacy of vitamin D, if we take it, can be shown after 3 to 4 months. If there is deficiency, we can use any form of vitamins, either as a capsule or tablets or as a drops. If there is deficiency below 10 nanogram, we can use 50,000 international units per week for 6 to 8 weeks. Then once 50,000 international units monthly for a year. After that, we stop it, and we for 2 months, and then we re-estimated and found the concentration in the blood. If we use it as a prophylactic, it should be from 30 to 300 to 60 international units daily, actually. What are the relationship between the infection and the vitamin D? As we know, vitamin D improving the immune system, the lymphatic immune system, the immunity of the body. It has a significant role. It's found in respiratory tract infection. It is stored in the alveoli. As we know, we have two types of alveoli. The vitamin D is concentrated, and when it is reactivated, it can increase the resistance. And with regarding to it is good. We found that it is the immunity power of the vitamin D in the infection like influenza and TB. With regarding to the coronavirus, there is no clear point of view about its effects. But however, in one study, it's found that many positive tests found in the human being, there is leakage or deficiency or insufficiency in vitamin D. So many literature say that it can be given during the coronavirus infection. It is better with calcium or magnesium to improve the immunity of the body. If we go back to the psychiatric point of view, it is found that the vitamin D deficiency is associated with many psychiatric disorders such as seasonal affective disorder, depression and anxiety, schizophrenia, sleep disorder, and dementia like Alzheimer, because it affects the cognitive function. So, if we noted that most of in many literature or researching found that there is a relationship between schizophrenia and who delivered in winter season. So it may be that it has an indirect effect because in winter we have leakage of vitamin D because the sun rays, it is deficiency. So vitamin D may be associated usually with schizophrenia. Also in depression, as we know, in depression, the incidence in winter, especially in the northern Scandinavian countries, there is increase of parasuicide, which is maybe due to depression. And in that area, the sun rays, it is it is small, so it could be related to leakage or insufficiency of vitamin D concentration in the body. However, it is, if we give vitamin D with antidepressant, there is no harm. With schizophrenia, there is no harm. It should be given for those who are elderly people as a treatment or as a prophylactic for prevention or further deterioration of their mental state, and there is memory. Vitamin D, it is good for general health. It is essentially for growing the bones. It could be, you can use for in case of osteomalacia and osteoporosis and multiple sclerosis, in diabetes type 2, in hypertension, and in respiratory tract infection. It gives some benefit. Vitamin D, it is, as you know, it is common leakage in all over the world. It may be the causes of this leakage or decrease in the concentration. There are many factors which led to deficiency. Could be there is a somatic illness or organic illness or physical illness, celiac syndrome, celiac disease, cancers, kidney failure, heart failure, hypertension, infection, all of these can diminish the concentration of vitamin D. In other area, as I said, it could be the intake of the sources of vitamin D, especially vitamin D2, as we know, we can get as a human being from sardine, tuna, salmon fish, kibid fish, and kibid of the cow, and from the eggs as a whole. We should take the vitamin D as we are a child or as an elder people, as a treatment or as a prophylactic. And thank you for your listening.